Hi everyone, welcome to this concept capsule. The idea as always remains the same, decoding the high-yield MRCOG concepts in less than a minute. And today's topic is clinical governance. So clinical governance is a system through which the NHS ensures continuous improvement in patient care and upholds high clinical standards. So clinical governance provides framework for safe, effective, patient-centered care. So clinical governance basically has 7 key pillars which you need to remember. First is clinical effectiveness, which aims at providing evidence-based care. Second is risk management, which aims at identifying and reducing risks. Third is clinical audit, which measures clinical practice against the standards. Fourth is education and training, which ensures that the staff are competent enough. Fifth is staff management, which aims at supporting and appraising healthcare workers. Sixth is patient involvement, which refers to listening to patients' voices. And last but not the least, seventh is information use, which involves using accurate data for safe decision making. So that was all for this concept capsule. Thanks so much for listening to me. Here's a question for you. Now I shall see you with the next concept capsule. Stay tuned.